All right.
Sounds good to me.
All right. Let's go. Diving in. The big unveiling event. So Matt, my name is Matt Simmons, President of Simtech Solutions. I'm here with Becky O'Meara and Kevin Charwat to discuss
Pretty good.
I'll try, man. I'm getting better. So this is the unveiling of the next version of Show the Way. And just a little backstory, the Show the Way has been something that's been in development for a long time. We actually built the first version. So this is technically version 3, but in a lot of ways it's version 1 because it's different than what we first did. But about 10, maybe 12, actually, geez, probably 12 years ago, there was a John Bon Jovi challenge grant, and we went for it, and it was about to build navigation tools for people experiencing homelessness. And, so the VA sponsored it. So with John Bon Jovi, we did some development and, had a resource directory, but it was the first 5 to the finish line, and we were number 6. So I was like, but it was a good working product. But then we started working on Counting Us, for those of you that know us for that. The mobile tech focused on homelessness, but really for the point in time count. And unfortunately, the Show the Way, it was, being a smaller company, had to take a bit of a back burner. But it was always something that we really wanted to focus in on, knowing that desktop-based solutions for people living on the streets wasn't really a good fit. So we'll talk about a little bit of the background of where HMIS falls short for those of you that don't already know. Some of this might be like, of course I know this, I live this, but I'm excited to be back at this moment. It's been a long process, but it's a labor of love, and I think you'll see that in the work that we're going to share today. So ideally, this will switch over. All right. So for those of you who don't know us, we've been talking about labor of love and the time. We've been doing this work since 1998. As far as the company was when we were founded, but as far as focusing on homelessness was 2002 when we switched over. But we've done different projects, whether it be focus on the smaller communities and really drilling down with housing first and creating the first prioritized by name lists, using a data warehouse, to being HUD technical system advisors, authoring some of the key guidance that some of the vendors follow as far as the annual performance reports, the HUD common separated variable exchange format. So I know some of you throughout the years, we're all in the same fight together, but our lens is really on the technology side and applying that technology to fill the gaps left behind from HMIS. So that's where we are with Show the Way. So the framework on the right really talks about, this picture on the right talks about Counting Us. That's our point in time tool against the point in time, it was mobile tech. For those of you who had to do the paper work, it's a process. So we automated that. Show the Way, focusing on the unsheltered population and really doing more as far as actively engaging people, recognizing people for where they are, understanding it's a process to build relationships, and doing that data capture, and the fact you need to work together as a community to help someone get from where they are to where ideally they want to be, which is hopefully housing. And then the data warehouse to tie the pieces together. So today we're going to focus on Show the Way. So as far as the problem statement goes, one of the things that we've seen is that we tend to leap in our data collection process when we talk about the HUD data standards towards really assessing people, and then telling them what they need. But one of the core tenets of, in this case, of the Maslow's hierarchy of needs is we need to address some of the basic physiological needs first. And you don't really need to assess people to if they're hungry, they know that. You don't need to ask them when their last meal was and all this, other assessments. You don't need to ask what family conditions to figure out if they're hungry. So if we can take care of the basic human needs first of food, water, shelter, safety, then we can move up the chain to a sense of belonging and purpose. But part of it is building the relationships with people so you can help move them up towards those higher parts of the hierarchy. So So our focus is arm outreach staff with the tools to address basic human needs, build those connections, as a byproduct of that. If you're coming into their tent every, day or a couple of times a week and saying, I have a meal for you, how are you doing? That's going to help you build a relationship with that person. So you have that trust. So then later on, you can start asking the pretty invasive questions about, that HUD is asking. So, if you were at a cocktail party, you don't ask someone if they're a victim of domestic violence. You don't lead with that. But, when we're doing street outreach in the way that the HUD intake assessments are, it's kind of forcing you towards those tough conversations, but you have to work your way up to it. And that's kind of our change in mindset and approach. So again, it's how can I help you today versus how can I assess you today is really the shift. And just being a genuine peer of that person and getting rid of the hierarchical structure we have of I am helping you help, and it's more of a we're going to work together. Like it's not authoritarian, ideally. You're coming at it from a we're on equal footing perspective. So where HMIS falls short. So PCs aren't well suited for outreach. You're not going to lug around a laptop or a desktop, through the woods or, in the riverbeds. I mean, you could, but it's not, it's not a really, effective use of equipment. So the HMIS data standards are pretty rigid. HUD has what they need to report back to Congress. Sometimes the questions that are asked will help you do your job, and sometimes they're not really helpful. So how do you find that balance? Because you still need, if you're getting HUD funding or getting SAMHSA funding, you still need to report on that. But how can we get them what they need while giving you what the tools that you need to do your job and really engage that person and get them connected to services? So again, to the point, they're too invasive for first contact. So what we're going to talk about is how we build that relationship, how we do the data capture over time, and not force everything to the first interview when oftentimes you can't even get the person's name at the first contact. So how do you work towards that? And there's acronyms and all. Basically the program descriptor data elements don't track operating hours. They don't talk about eligibility criteria. They don't really detail what services are provided by the project, what assets are given, et cetera. So, we're going through that effort in HMIS to manage what inventory you have. And again, that helps produce a housing inventory chart report that you can submit to HDX. But what does that mean as far as helping people that are homeless or helping people that are around part of your community know what others are doing? It's close. It's like a list of names, but without knowing what they're actually doing and contributing. So the other side of it, we want to do a gaps analysis to figure out what we still need. You're missing some parts of the puzzle. So, we're going to help flesh that out, but also make that information consumable both by outreach workers and by people experiencing homelessness themselves, so they can go get the services they need. And that's another area where we feel some of this typical structure falls short, is you're not relying on people's ability to help themselves. You're basically putting yourself in the middle of the bottleneck, being an outreach worker, service provider, et cetera. So how can we bring these tools to the surface so people can help themselves? And then, when you come down to HMIS data quality and trying to use this data for reporting, if you're collecting Jane and John Does throughout, your community because you don't have people's names, or you're not doing the full intake, you've got data quality issues that could impact your regional reporting. There's a reason why the system performance measures in the LSA often, you look at the specs, they're really not looking at this population. And for communities in California and Texas and anyone that has a decent street, homeless population, that's a huge part of the puzzle that's missing. And the other part of it is knowing who's actively out there on any given night. Oftentimes with HMIS, what you'll see is people do intakes, but they don't exit people out. So what you'll see if you look at it over time is you see this kind of like ramp effect where your population's always growing, it's always growing. And really that's people that you haven't seen in 30 days, maybe it's 60 days, depending on how many outreach workers you have, and you can set up community rules, they should be exited out. Have been seen since. If not, they're inactive, time to move on and tighten up your reporting universe. So anyway, part of it is how are we capturing the data? How are we monitoring the data quality so we can get a tight picture of who's actually homeless in our community, both from the shelter side of it as well as the street. And then the other side of it is HMIS, you're doing the intake, at, some office, maybe if your outreach workers go back to the home. That's not really helpful if everyone gets enrolled into a project at the admin offices of the outreach provider. What is really helpful is to capture the exact physical pinpoint of each interaction. So that way you can see migration patterns, you can see density patterns, you can know where, if people are being drawn towards certain service locations like a magnet. You can see if communities aren't serving people that they should be serving. You can help control where you're sending outreach teams, et cetera. So geospatial data, really important. And then from a reporting perspective, if I have a big county like San Diego County, which is full of, different cities and towns, to be able to report on what's going on for that particular city, so I can go back to the mayor and say, hey, mayor, you have a problem, and this is the gap, and this is what needs to be filled. And otherwise, you're really, mixing pictures, by putting everything at the county or the state lens, or the COC. So there's that. Also, universal data elements, they do fall short, and this is some bias. It's also based on what we've heard from the community, especially working with the youth population. They're missing sexual orientation universally. So, if we know that's a problem, that, people that are LGBTQ are more likely and more to experience homelessness, then we need to think about how do we unpack that, how do we address that for that target population. But if you're not capturing the information, you're never going to be able to do that. So, we ask it. Current living situation, a place not meant for habitation. That's really broad. We can tease them more out of that. If we want to do safe parking programs, for example, you need to be able to say how many people are living in their cars, right? So just basic place not for human habitation, too broad. Prior residence, it's great to know that people are coming from hospitals. I mean, you don't want to, it's great to know that. Doesn't mean that you don't want that to happen. But how does that help you with discharge planning? What if you have 6 hospitals in your community and 5 of them are doing a great job of discharge planning? How are you going to tease out that you have that one that is always dumping people onto the streets? Well, you need to really capture information about those institutions that are upstream leading towards homelessness downstream. So, we want to be able to inform that too. Referrals are tracked manually. So if you send someone from the street to a shelter, you may record an action, later on in HMIS that you did that. Ideally, everything's automated. You refer someone to a shelter, the shelter gets the information, and they can either accept the person, waitlist the person, reject the person. And if it's a rejection, why? And then you close that loop. And then coordinated entry really as a concept sounds great, but when you're actually not coordinating because you're actually enrolling everyone into a separate project and it's not really systems talking to systems, and you're really creating this new bucket as a workaround because you haven't figured out how to have systems talk to each other, that's duplicate data entry. That's a chance for data conflicts because, in your project, someone might say they're a veteran. In the coordinated entry project, they might not indicate they're a veteran. So we're trying to avoid that duplicity and that overhead by ideally having system data flow to other system data. So our approach to all this, and those articulated some of the kind of the key stumbling blocks and problems that we saw when taking this work on, really is to come back at this and say, what are we trying to accomplish, right? So be pure of thought, and really it's to help people, right? So in order to do that, what tools do we need to help people? And then as a byproduct, we'll meet the reporting requirements. So we came at this with a human-centered design approach. And really what that means is we're looking at it from the people we're trying to help, from their perspective, and what tools do they need to get from where they are or where they were, if they're people that have lived experience but are now housed, and what is it going to take to get them into the housing, and what would have been helpful. So we did pilots in Houston, in Charlotte, in San Diego, Lowell, and we're expanding that too. We're always learning now that we're onboarding clients. So, and I will say that when we develop and deliver software, we're not done, just because we went live. We are learning constantly and we're refining. So I tend to use the word pilot because I don't want us to be done until we have it all working and everything is bulletproof. And this is like, but I can, if you compare what we have today, we're what other tech companies would have called, version 8. Like we're pretty far along in what we have. But again, I just want to echo that we're not done because we're still listening, we're still learning, and like all of us should be. So how do we do that? Like how do we get feedback? We take people out to breakfast and buy them breakfast and sit down and ask for their stories and get feedback that way. We have everyone that's used the Counting Us app. So we've got, this year was less because it wasn't HUD required, but we still had a wide, really wide adoption rate. We have that ongoing engagement with our clients, and we get the feedback of, and this is kind of like a sister app for that mobile tech, the GPS enabled mobile tech for the point in time. And we use that to inform what the work is for Show the Way too. So we can use that. Michael Joseph, he might be on the call today. He is on our staff, and he actually runs a meal distribution site here in San Diego. And we're able to lean on Michael and get his experience, being both, being a veteran who has experienced homelessness, but also the other side of it is he's engaging in his job with outreach staff on a regular basis. So we have someone that's more connected than I am when I sit at my desk. And yes, we still try to get out there when we can, but it's nice to have some boots on the ground. And then part of it is the joint architectural design sessions, the fancy term for saying, we're going to share what we have, get your feedback. So and then be an iterative process to make it better. So there's that. So benefits of mobile tech, and sorry for being long-winded, but I think it's important to kind of share like why and how. Real-time data capture. So, really the device is right in front of you. You don't have to wait to go put something in after the fact. Custom surveys, we do have the ability to, take core templates and modify them and ask things that are region specific. Conditional logic, meaning you're not going to ask questions that aren't relevant to the target, population that you're interviewing. So you're not going to ask a 16-year-old if they're a veteran. There's different examples of that, but that keeps the forms short and concise. The geospatial reporting capabilities that I talked about. So when you do geospatial data capture, you can do geospatial reporting. Project management tools to oversee everything going on. That way you really have a centralized view into what's happening with the different people that are doing the work on the ground, which does include outreach team management to know who's in what areas, really kind of make sure you've got a good canvas of what's happening. And that's the dispatch map is part of that. So you have the map-based interface to know who's where the population is, do we have any gaps, and make sure that we have a strategy to make sure there's nothing falls through the cracks. And then the ability to take the data out and report over it however you want, create dashboards, et cetera. That's important too, because we want that feedback loop. So on the geospatial planning, reporting and planning, we can do things like designate coverage areas for different outreach teams. So you've got your projects, and then within the projects, you can have teams. And you can actually designate parts of your community that certain teams need to cover. So you can actually look at using the data that is captured on an ongoing basis to quantify the need for resources. So part of it is when people say they need something such as socks or what have you, you can quantify that. But you can also see the density patterns of where the people are currently on the streets. And when I say streets, I use that term loosely. It could be the woods, it could be anywhere not meant for habitation. So you can look to see what has been provided by whom, where, and when. So, if you're, currently here in San Diego, we're supporting the meal distribution efforts for the Lucky Duck Foundation. They're providing 1,100 meals a day, and we can see where those meals are going throughout the entire county. So, and who's giving them out and where they're going. So that way, when they get a new outreach team coming on board, they could say, you know what, we've got a gap here. If you could take this area, that'd be great. Or if maybe an outreach team, a couple people are sick, they can't cover, they can look to see who else is nearby to fill that gap. So that people, there's consistency, and we can kind of build up those relationships. And then the other side of it is the supply chain planning. Once you know what the needs are, then you need to know what you need to backfill. So, currently we're tracking where things are going, but ideally with asset management, we can start providing an inventory management, functionality. So once something is assigned to someone, so if I give this pair of socks out to the person in front of me, my inventory for socks goes down by a pair. And then at some point, I could think about reorder thresholds, or working with, this is where you could work with the community to say, I need a certain amount of these on an ongoing basis, and make that public facing to help, the community donate for certain things that you always need. So it's another way to be active, let the community to weigh in without necessarily having the community, the citizens going out and doing outreach, because they're not trained for that. But there's ways that they can help. So that's a roadmap item, just so you know. So I do want to share where we are and what we have in mind. So on Show the Way is a preview of some of the screenshots on the side. It's basically enables 3 outreach teams, first responders, and other navigators to better serve people living on the streets. That's important, when we say first responders too, because we have role-based security here. And some of the feedback we received from the communities on the first responder piece, for example, was we don't want first responders accessing the app and using this as a chance to look up people and find them and go arrest them or serve them a warrant. We want them to be able to be on our side, and for the good guys, if you will, of the first responders, be able to record interaction, occasionally refer someone over to our outreach teams if they need help versus arresting the person. But what that means is that role is a one-way post of information versus looking up a client, looking up where they are, and reading into the database. They can submit, and they have enough to look up the person and identify and create a unique match, but they're not going to find anything else about the person, and they'll be able to add start an interaction, and ideally pass the baton if they need to someone else. So the idea of role-based security, there's a couple places for that, and I just wanted to share that. It's not open access for everyone. So to provide the person, person-centered care while meeting the HUD HMI data standard requirements, that's important. So, it's a byproduct of the interaction. And yes, there's some parts where you do have to dive in and start building up that profile and doing those assessments, but it's part of the interaction. It's not I'm going to get it all right from you right now, because that's not natural. If you've ever done 3 outreach, it just doesn't work that way. Again, GPS locations, to be able to be an outreach worker and see who your active caseload is, and know what your clients are or who they are, to be able to actually see pictures of your clients too. We work with a gentleman, named Greg Festi. He's in Houston, and a good example. He has helped us inform our My Clients page of the app, because people would go up to get showers from Greg, and he didn't necessarily know who the person was, even though he knows. I know I gave this person a shower a week ago, but I don't remember everyone. I serve 300 people a day. I don't remember all their names. But when he goes to location now, he can search on that encampment, see the list of clients at that encampment, and see their pictures. And before the person shows up, he can look at their face and say, "Oh, that's John," and be able to greet that person by name. So it's not only just viewing and managing a client roster, it's really a kind of a customer relations management tool for street outreach, in the sense you're building that rapport. But when you can greet someone by name, it just drops the defense up because you're building that relationship. So that's important to just call out. And then we have 3 methods to uniquely identify someone. So from the HUD data, from the data quality perspective, what you don't want to do is add a new record or create a new person every time. So what we do is we have the ability to look up by name. If communities that have an ID card, we can do that and we'll do a barcode scan. And we can also use Amazon Rekognition, which is a facial recognition software, to basically take a picture of someone and you uniquely identify them that way too. So, and that's an optional functionality that we can talk about. And then to be able to review information captured by other navigators. The idea is, everyone gets the chance to go on vacation, take a day off. But if you're living on the street, that happens, as long as you're on the street, you might need help. So we can be able to pass a baton to whoever's on for that day, and they can pick up from where you left off by sharing information. To be able to do light touch assessments with customizable surveys, and I'm going to spend a little more time on some of these things in a few minutes, so I probably breeze through these a little bit faster. Identify unmet needs and capture details on the services provided. Take case notes, create follow-ups, reminders, and set alerts. Log observations of people who can't be engaged. That's important too. You can't always interact with someone. Sometimes health and safety risk to yourself. Sometimes the person's incoherent, whatever it might be. But you want to drop a pinpoint on a map saying, there was a person here, here's some basic information, kind of like the observation survey in Counting Us for those that use that technology. And then automatically track your contacts and engagements. And that piece is important for chronic homeless determination too. And again, another known gap of HMIS-driven, outreach. We want to be able to quantify every single outreach and every single engagement because that goes in your chronic homeless determination, and that's part of what helps prioritize people for housing. So if you're following the HUD prioritization notice, you're going to look at the whole longitudinal picture of someone's homeless experience. And if you've got gaps because you're not capturing those interactions with people living on the streets, that person might fall further down on the list than someone that's always showing up at shelter because it's easier to capture that information. But really, this person that's on the street might actually be costing your community more money in finances, may have higher service needs, but you're not demonstrating that. So it's important that we're painting that full picture and using this to do that. So I think I'm going to pass this on to Kevin and let you share share your work from here, Kevin. That was and sorry for the lengthy overview, but the mic is now yours.
No, I don't think it's a lengthy overview at all. It's always great to hear the themes and some of the reasons of why we're even here. HMIS is kind of the ugly beast that's always rearing its neck, and we're trying to take things away from being so burdensome and really provide tools that are flexible to help that process easier and make that process of HMIS data entry really a byproduct. We're first and foremost for the people. We're trying to get people housed and helped, as well as help those outreach staff and the community as a whole. We don't want to have people carrying backpacks around with all of their hygiene kits, their socks, and then tons of intake assessments, right? Just for them to go back to the office, enter all that data into coordinate entry, and also into their street outreach project. So I'm sure those of you who are aware of HMIS, we don't need to belabor that, but it's a common thing we all live in. So it's great to hear that, and happy to share some of these different tools that are part of the app as a whole suite to make that process a little easier. So here's the case management functionality. It's one of the core functionalities for working with clients. You'll see on the left picture, there's 3 different main areas of this functionality. You have your start interaction, which is what we're calling anytime you're working with a client. Look up clients if you have some information, someone's name, or they're providing you something for you to look them up. And then you have the My Clients tab. So the My Clients tab, you can see that inside the center picture, which, that's a way for you to really have your own client roster. These are the clients that you're working with, whoever you've interacted with, or clients that you've created, and kind of want to make a note that it is either or. You don't have to necessarily always collect data on a client for them to be your client. It's just a quick way for you to access people that you need to in the future. On the right, you'll see the different kind of case notes that you can add. So there's all kinds of different data elements that you can record, right? There's assessments, there's demographics, there's all kinds of goals and referrals. Over here, we're just looking at 3 different notes that you can add. You have your generalized notes, those are just things that you want to know. Follow-ups are going to be appointments, things that you need to know for the future, something that we can integrate with the calendar feature that we'll see in the future. And then alerts are going to be something that we want to share across our support system, right? Your coworkers, things that you need other people to be aware of. We've heard stories of, staff members getting into cars with these other clients that, someone else knew that they were a sex offender, right? And it would have been great if, person B knew that. So unfortunately, it's not, easy to share that information when you don't really know who's going where. So this is just kind of, again, one of those themes of us trying to have information collected that's really meant to support the clients and yourselves while working with these persons. All right. Something I have, oh, sorry.
You want to take control?
Just, yeah, I'll try that.
All right.
All right. Just to make one quick note about the lookup client, there are, we mentioned it on the other slide, there's like 3 main ways to access your clients. There's just looking up by name, by date of birth. There's also barcode scanning. So if you guys have a way to produce barcodes, we can use that inside of our lookup. And then another one would be facial recognition using Amazon's, it's called Rekognition with a K, software. Just want to make note, it's not saving any pictures. What it's doing is basically taking a picture, creating a unique identifier, and then we just store that unique ID to find clients. So it's another way for you to just take a picture of someone you're encountering, and then, with their consent, of course, and then find their profile so you don't have to go looking through everything. All right, here's another next step of the case management functionality. Let me just kind of apologize for the steps in the sharing. All right, we're on this page. So here's the case management extended. We're looking at the history. So a big thing with the GPS-enabled survey location pins is going to be knowing where clients have been, where you might need to find them, right? Client comes up on coordinated entry, they're ready for a housing referral, and 2 weeks goes by because you simply cannot find them. This is one of those tools to help you identify where clients have been. Maybe you can go visit that location, see if they have any cohorts that might have seen them, and really help get that person housed. So I know CE it takes quite a while to just get prioritized. So let's try to get them housed as soon as possible. So here you're just seeing the list of interactions. The different surveys are listed. So on the left, you can see there's 1 survey, 2 surveys, etc. The middle of the map is the pins. You can open up the location, get directions to that area, what have you. And on the right, you're seeing that interaction as a whole. Wherever the survey is completed, was there goals set? Were there needs that were recorded during that time? All that's going to show up on that screen. All right, so we talked about some of the secondary or tertiary data, right, around client profiles, but we have yet to touch on assessments. So during interactions, that's really how we are defining like a session of you collecting data. So those of you that are familiar with HMIS are very familiar with the word entry, and we're starting a new enrollment here. So you'll see in this picture, we are part of ISRI Outreach Project, so ISRI Outreach Project A, and we're going to do an entry interaction. This is because this client is not actively enrolled. So we're going to start that entry interaction, and then we're going to be able to collect all the assessments that are tied to our program. And we can see that perhaps in a live demo. But the point is, we are working with this client. We are part of the project. We're going to be shown which assessments we need to gather, and we're going to gather those as we can. Big note is that collaboration. If I'm only able to work with let's see, John Doe, and I'm only able to get 1 assessment completed, that's fine now. My team can come back another day and continue working off from where I left off. They'll be able to pick up that information that I've already saved, edit it if they need to, and then continue working on all the other punch list required assessments. So the point is not to just go through everything all at once. You got to meet John where he's at. In addition to all those HMIS required assessments, you guys can collect anything you guys want. I keep that generalized because it's truly that generalized. Any custom questions and logic, as you guys see fit. Point is, we're not trying to be locked into data standards, right? We want to gather what we need and things that are maybe more insightful. And of course, all this data is available anytime for export and other reports that we have available in the command center. Something that's not really shown is that the HMIS integration, and we can kind of touch on that. But again, this data can be exported. It can also be exported into CSV format if your HMIS vendor can do that import process. So yeah. All right, so we kind of talked about it, and now here's a little overview of how the functionality works. This is a GIF kind of going through working with a client. So we are starting an interaction, choosing your location. In this GIF, we're changing our location because we're all working remote. So I'm moving over to Houston. And you can really pinpoint exactly where you need to be. And then you're going to be gathering the HMIS data standard for a current living situation, but we're going to add a little bit more information on top. This person is staying at an outdoor encampment. Here are the assessments that I mentioned. Here's one example of an assessment. You can see here, things are turning green. Again, working towards completing everything that's needed. And there, I'm done working with this client. So let me go back to my home page. All right, so now we're on to the next bit of functionality. One of our core pieces would be encampments. More of this GPS-enabled tracking, not Big Brother tracking, just knowing where things are, of knowing where different encampments are, and using that information to be able to plan your day and really group clients together. So you can create different encampments, just like creating different survey pins. You can add images and details to the encampment. So this is a big thing where we currently have a single picture, and we're working towards having multiple pictures, knowing that sometimes camps can span large regions, and we want to know how the areas are really looking and help navigate for those that have never been there before. Camps are going to be their own ways to track what's going on in your community, but we also want to connect clients to the encampments. That is really so you can access clients quickly and really work with who's there in front of you, and another way to really pull up your list, right? You can use My Clients if you just happen to know everyone and you are the superstar of the street outreach. But hey, if you're walking up to this San Diego camp, maybe you don't know everyone, but those that are staying there, you'll be able to quickly view through this client's list. Something else that you'll notice in the middle picture is the active status. So right now it's green because that camp is active. When planning encampment sweeps, we can toggle that and really fire off different emails or messages to whoever works with those clients to really get an action plan in place for that encampment sweep. All right, so here's going to be another walkthrough of the encampments. I think the GIF quickly went through the intro, but I'm pulling up the same client that we were just working with. We're going to go ahead and add a follow-up. So we don't always have to go through this whole process of starting interaction, putting in a location and all of that. Let's say I just found out this person has a second vaccination. I'm just going to go and quickly find that individual on the list. And now I'm still working at this encampment. So let me go ahead and now I'm working with John. I'm going to find his existing profile and say, now John is now staying at this encampment. And from here, I'm working with this client and I can do anything with his profile. All right. Next section of our app is going to be the resource directory. We talked about self-help, and we can touch on the public role and roles for persons experiencing homelessness later. But what you're seeing here is a resource directory that's initially derived off the HMIS project data. So we have the ability to take that data from HMIS, populate your resource directory, but we want to add more information on top of that. We don't want to just know what the project is and what kind of project type. We want to know where it is, what they serve, what they offer for services, and when they're available. As you can see here, we're going to go to that functionality in the app. I'm going to scroll back on over to Houston. I'm going to open up one of these projects. You'll see this is the information that's displayed. I'm going to go into that profile, go into the details, and then be able to edit that information. So the key takeaway here is that we're going to try to add more information for persons experiencing homelessness to ultimately receive or request help, as well as just provide other outreach staff with available resources that are open at this point in time. So plans for the future of updating that via text, via email, or what have you, but this is an example of updating within the app. All right, here's outreach team management, and we've touched on this for the planning purposes. Here we are looking at a project, Street Outreach Project A. On the left is the command center, so this is the setup. On the right back picture is also the command center, and the show the way app picture is showing you how you can access that project and toggle your active assignment. So someone can be part of multiple projects, and they might have different coverages. Maybe I'm going to this particular coverage area on Monday and Tuesday, but on Thursday and Friday, I need to go somewhere else. But I need that person who's managing the command center to really tell me where to go. So it's a planning tool as opposed to everything being through emails, Google Maps, or what have you. This will be a quick look at how that's set up. Opening up that particular project, we can enable teams. Teams are allowed to cover different areas and also cover the same areas. So here we're just adding a couple users to the project. We can go ahead and create a couple teams. And then go ahead and define the coverage areas. So everything is based off census tracts. So you can see here, it's pretty quick. You just edit those tracts. And then the second team is going to cover some of those same areas, but slightly different. And then cover some of this area in the northwest. Last step is just adding a user to that team. So this team at Simsec account can now choose this project under their active project assignments. And this last page is just showing this is the overall project reporting by project. We can look at the entire project coverage based off the teams within them. All right. That was a quick view of the different main portions of the functionality, and I will turn it back to Matt to talk about what do we do with this data now that we've collected it and we have, a list of clients to work with.
All right, thanks, Kevin. Appreciate the demo. And apologies for the noise in the background. I do work from home, and sometimes life happens behind you. So I think I'm probably not alone in this one. But anyway, so by name lists. What are they, and why are we doing them? I think for those of you that are either part of the Built for Zero campaign, so through Community Solutions, for those of you that have permanent supportive housing dedicated to chronically homeless, which is hopefully most of you, there's a need to prioritize who is up for those precious housing resources. So how do we curate those lists? And I know in the past, a lot of communities have relied on self-reported information with tools like the VI SPDAT. So you're asking people, various questions at the end. There's a score. Well, you may or may not know, but that assessment's no longer being supported. And there's some reasons for that. And one of the things that we've been trying to do since the very beginning is use empirical data wherever possible. So empirical data means existing transactional data, trying to avoid self-reported information where possible, because people that are desperate, there are people that would say whatever they need to say in order to get housing. And one of the things that we actually found out when we were looking at some of these scoring tools and these assessment tools is there's bias in how they get applied. Both there's racial bias on the scoring. There's times the tendencies for that, and there's also bias against people with mental health issues, in the sense that they were scoring lower than some of their peers that didn't have mental health issues as a cohort, which is surprising. But when you think about from a scoring perspective, but when you think about the nature of mental health and someone's apprehension potentially to share their full story, partially out of concern that this might be used against them. Whereas other people that may say, may think, I'm going to share anything and everything, and I'm going to make some of it up in order to score higher. Well, anyway, our approach is to say, let's curate all the data together, the empirical data, and use the history to help inform what the future projections might be. So just like you might pick stocks in the stock market, I know it's a totally different analogy, but you can actually use past performance to predict future results. And what we're trying to do here is think about who are our high utilizers of not just of shelter, but also of the emergency rooms, also of jails. The people that are always on our streets. So, and the people that are always interacting, and every time there's that interaction, there's a cost associated with it. Markeia Watson from Kansas City said that every time that the police get called on someone, it's $5,000. That's an anecdotal piece of information. But if you think about, someone, if they have 20 interactions over the course of a year, well, that's $100,000. You can do a lot with $100,000 for housing and other things. And then, some of our very early work was looking at inpatient stays and ER visits. And we were able to look at the cost savings attributed to those emergency rooms visits and the inpatient stays and say, well, no, if we can do pre and post housing cost analysis and cost benefit analyses, we can figure out, is it actually saving the community more to put someone into a better living situation than keeping them homeless. And sure enough, we were able to save almost $10,000 a person. And this was, 15 years ago, just in the medical cost savings in the cost of the shelter, providing those shelter beds versus comparing it to actual housing. So anyway, what we do is we take the HMIS data that you're already doing data capture for, and we can take the data from Show the Way, which is also HMIS compliant, but it's not your traditional HMIS system. It's a different HMIS component, so functional interface, if you will. Bring that data together and then curate a single prioritized by name list off of the two data sets. And then if you have other data sets that we can incorporate if we're working together and we have the data sharing agreements, we can actually layer those on top. So the idea being empirical data, evidence-based practices, evidence-based decisions to help inform those housing placements. And then also on the dashboarding side, we do performance analytics. We want to be able to look at, are we utilizing those PSH units to the best of their abilities? And are we doing everything we can upstream before someone gets PSH to make sure that there's not another intervention? And so just one thing to share for one of the partnerships I'm just going to tease out is we have a partnership with Miracle Messages, which is a nonprofit based in San Francisco that does family reunification. And by adding a family reunification survey and asking a simple question, do you have anyone in your life that you'd like to be reunited with? We're able to capture information and then hand that over to these digital detectives at Miracle Messages, and they can actually take that information, try to find the person they want to be reunited with. And if they want to be reunited, we can actually make that introduction through them and save up a PSH unit and free it up. Because and what happens is we actually, just an example, we just, there was someone that was homeless for over 20 years, just got reunited with his family, and met his grandkids for the first, as meeting for his grandkids for the first time, but which is an awesome story, but that comes with the social supports, and it's one less PSH unit to have. So anyway, the binding list is important for people. We tried all these things, and if we've tried them all and they're high on the list, then they should get housing. And then we can go back and reflect, and we can tune the list and our prioritization models as needed. But the important part is to get the data together. So, you're using the ongoing outreach efforts to support the by name list. And then if someone shows up on the list, you're using an alert functionality within the app to say, hey, this person's next in line for housing. And you can use the map to find out where they as Kevin mentioned, where they travel. And, also do things like we're doing in Houston, for example. They just did a housing surge. They cleared out an encampment. And that's, in some communities that's taboo. But if you do it right, it's what they did is they did a housing surge with that encampment. So we were able to create a by name list of 28 people living in this encampment. and then match each person up to housing one at a time. So you have this ability to, again, you can have targeted by name lists. That this, maybe it's just for this encampment, we're going to take everyone and put them into housing, or maybe it's for the community. We have this, and be able to filter it too. We have veterans housing for someone that's 18 to 20, 40-year-old female, to be able to filter the data and say, well, here's a list of 18 to 24-year-old female veterans we have. Who is top on the list as far as the community prioritization model? So that's the other side of it. So the other side of it, you can actually look at this for planning. You can improve your data quality, but it's a management tool. So you have, and if someone asks you how many homeless people do you have in your community, you want to be able to answer that. And for those of you that work with us in the point in time count, the point in time count is a comprehensive canvas of your whole community using volunteers. We're not trying to replace that, but if you have enough outreach workers, you might not need to do a point in time count with volunteers. You could use the outreach staff to curate an active by name list, as well as their worker first responders, and then be able to run a report on January 26th and say, well, here's how many people were living on our street that day. If you don't have that volume, you use the point in time count work to say, here's our full picture, and we're capturing about 70% of that on a day-to-day basis. So we have work to do. So it's another check and auditing point, and we can overlay that point in time data, by the way, in the command center, which is so you can see what you have to work with. Here's all the people we haven't connected with.
Hey Matt, just want to add one note on that. I think
Sure.
We've talked a lot about the outreach efforts and gathering this data, but in terms of the point in time, I think it's important to note that ultimately we want to get rid of that point in time annual exercise, right? Like we have all these clients on our list, we know who we're working with. So I'll come that single night in January, all we have to do is verify if they're there. We have all their information. We don't have to go through and ask them, their entire life's history and, risk traumatizing them. And so hopefully we can just get rid of the point in time altogether.
Yeah, so it might be more of an attendance exercise at that point, knowing you're capturing names, but if you're already capturing the data in, show the way over the course of the year, like those tough questions we talked about, the mental health conditions and safety conditions, domestic violence experience, you don't have to have your untrained volunteers do that work. So, that's another point that, to bring up. So, can you get rid of it altogether? That's going to take some work and some lobbying, if we're going to do that. But to be able to at least limit it to attendance tracking, I think there's value there. Because then you can actually have those same volunteers survey a lot more people, and really you're just confirming your living situation, and then seeing if there's a match in the system and taking it from there. We do have something. Okay, we have 3 minutes left. Okay, so. All right, moving on. So I know we're running a little short on time. We could show a basic demo of this, but I think that high level overview is really basically we kind of hit on the steps there. So I won't do that. And maybe what we can do is just again showing how the data is integrated. I do want to leave some time for Q&A, but this is basically showing how the data from HMIS can be sourced from HMIS and be added to fill out that resource directory. I'll leave this for a second, but in general, you can kind of get an idea. This is information that's already seeded from your HMIS system, and then you can add labels and tags to that to make it easier to find those resources. And then we could talk about roadmap items. I'll share that really quickly. About some things that we're working on. We have where we are now and where we're going, but this is some things that have come up through those joint architectural design sessions and just emails and conversations that we want to keep working on. And I think let's just move on real quick and jump over to Q&A because I want to make sure that people have questions, we have time to answer them. So you can either use the chat functionality, you can take yourself off mute if you want, or we can take you off mute. But welcome any and all feedback. If you're shy, you can always reach out. You know, if you work with us at the point in time, you know, it's team@simtechsolutions.com. It goes to all of us, and all of our personal email addresses are really just our first names @simtechsolutions.com. So you can reach out that way. Phone call works too. But yeah, if anyone has any questions or comments, now is the time.
Hey, Matt. Yeah, I had a quick question. In terms of integration with HMIS, it's basically CSV, right? Through the CSV import? If you're
Yeah,
working.
currently, I mean, if your HMIS vendor has the ability to do something differently, like an API, you know, we definitely would be willing to explore that. But if they don't, then the HUD CSV export is the easiest to accommodate because it's a standard. And then beyond that, if your vendor can't receive data, the other option is to use the Homeless Data Warehouse and then combine the data there. So we have a backup option because we can do all the regional reports there and do the prioritized by name lists and the dashboards through the warehouse if your vendor can't receive data in HUD CSV.
And then in terms of using the app itself, does the data live in the cloud, or does it live on the device in terms of, just say you lose signal or something like that? How does that work?
Yeah, good question. So the data does reside in the cloud. We use Amazon Web Services hosting infrastructure to support that. So yeah, it's a native app that you still download. So you're not firing up a web browser, so you don't have to worry about that part of it. So really, the data transfer is limited to the additional information you may capture in a survey, but all of the icons and all the things that you would hit if it was fired up from a web browser, those are already sitting on your device. So that, at least for that part of it.
Okay, and sorry, just one more question. In terms of customization, do you guys do the customization, or does the client do the customization?
Currently, we do, just because there's chances to mess things up. So what we tend to do is we work off of we provide a Word document. It's a template for any of you who use this for the point in time, and say, here are the questions, how would you like them to revise? And we use track changes, and then we do a review before moving the survey live. So we're doing the actual work, but that way too, we understand the conditional logic, how that works. We understand the HUD reporting requirements. We make sure we don't trim anything out that's needed. We want to be partners in it, and it's a balancing act, because at some point, for some people, that they might understand how to do it and not break things. So we just want to make sure that people don't do that. We want to make it work.
Well, looks really good. Thanks a lot.
Yeah, glad you were able to join.
All right.
Thanks.
Hello. So in Kansas City, as Kevin knows, we use Caseworthy. I'm just wondering if there has been integration or use with Caseworthy, or if you've used those systems that have been connected in other communities. And then also wondering about once a community decides to move forward with this app, what that timeline would be to be able to get it live.
Yeah, I could take this. We don't have any direct integration of receiving HUD CSV. It would really be working with the vendor and asking that question: can you receive data in the HUD CSV format? That's, and if you include us on any correspondence, or if we were to, you want us to ask, we can do the same thing. Most vendors are seeing more of a need to be able to do that. But again, as a workaround, if they can't receive data in the HUD CSV format, we can run all the, we can work together to run all the reports in the warehouse. And for Kansas City, we do have, Kansas City is already an active client using the warehouse, homelessdata.com. So we could produce all the reports there if Caseworthy can't receive data. So when I say all the reports, it's like your APRs, your CAPR reports, the LSA, the longitudinal system analysis, your system performance measures. We have them all in the warehouse.
And would it also pull data from Caseworthy into the app, so that you already have a starting point for the folks that might be on the
Yeah, we can see the database with HMIS data. So that's every vendor has to be able to produce data in that format to get it out. They don't have to be able to produce it to get it in, to be able to receive it. So anyone that gets SSVF funding, for example, support service for veterans family, or RI funding, as a funding requirement, they have to be able to do that. So we can see the database with what's already in HMIS for your shelter projects. I mean, your unsheltered projects.
What about like the timeline for?
The biggest thing is any customization that might be needed. You know, and then working together as a team, you know, to nail down what the questions you want to ask. You know, from contract to execution, you know, to go live. What we've done in the past is we had a, you know, we prefer to do a soft launch. That way is a chance to share, this is what, you know, get feedback. And then if we need to change things, it's okay. You know, and we call it a soft launch because it's intended for like people to know, like, yeah, bang away to break it. You know, this is what you're going to be using. We want it to work for you, and then come back to us with any feedback, and then we go forward with you know, the real deal, you know, version 2 or whatever it might be. So typically you're going to have a couple weeks turnaround before you do the soft launch. We'll do initial training, guide people through it, do a soft launch, call it, you know, maybe let that run for a week or two. Then I have a follow-on meeting, you know, afterwards. We get the feedback, and then depending on how many things we need to change, you know, that's what will determine like the real official go live date. But some communities that don't get the HUD funding, you know, or they love it as is, they're willing to skip that process. It really depends on the community. Just want to let you know that we're willing to do that because we want buy-in. We want this to work.
It looks really amazing.
I'd also like to just add, like, there's steps to the implementation, so we can get you live very quickly on just like gathering surveys, gathering, you know, client profiles, seeing that database. As far as like a full-on integration with a coordinated entry, like that's a different story, to make sure we have the right assessments and that kind of like workflow for notifications and all that kind of stuff. But everything that we went through in the GIFs is in a live version of the site. So that can be, that can be uptaken pretty fast.
Yeah.
Perfect. Thank you.
For sure. I'm glad you like it. Okay. Any other questions? We'll do the awkward pause moment. And all right, I think we're good. All right. So if any, again, you have our contact information. We will be recording this. We can send it back along. You know, if you had a question you didn't think of and you want to follow up later, you know, just shoot us an email, give us a call. But thank you all for letting us play show and tell and share all this work. It's been a long time coming, and we're excited to get it out there. So thank you. All right. That said, everyone have a good afternoon, and we'll hopefully talk to some of you soon.